Is that I've been a practicing psychologist for over 30 years and have served in various roles in different state associations that I've belonged in, and have been a very active member in support of prescribing authority for psychologists. And again, I think this is where psychologists are going to be fine. We're used to trying to figure out, is this a mental illness? Or is it the result of either the side effect of some blood pressure medication or some other condition, or what else is going on in that person's life that might be mimicking, if you will, a mental illness or a mental disorder? But we do know that there is no reason for you to be afraid. What's more important is for you to practice good psychology, good risk management strategies. For example, making sure you have appropriate informed consent, making sure that your documentation is accurate, making sure that you fully inform people of risks, that you order the proper medical tests and lab reports, that you get complete history. There are several different aspects of gathering information and documenting them that can protect prescribing psychologists so that they do not need to be fearful. They say to me, "Oh, I never speak to my psychiatrist as openly as I speak to you. I couldn't imagine talking to my psychiatrist about these things." And when I've asked, "Well, why not?" they say, "I don't even know this person. I go in for 15 or 20 minutes every 6 weeks. I'm going to tell them things?" It took me years to learn how to try to trust someone, and we've been in therapy for a long time or a short period of time, but I feel like it's been frequent enough. I trust you. I don't trust this other person or have a relationship in which I feel comfortable discussing what side effects I may be feeling. Why can't I just tell you and then you tell that psychiatrist? So that's not a lot of time for us to gain any experience in being able to predict whether or not prescribing psychologists are at greater risk. But what I can tell you is we don't have any data that says that prescribing psychologists are a greater risk than anyone else who prescribes. We don't have that data either, and to me that's just as significant. I think that legislators should pay particular attention to the fact that psychologists are the best mental health practitioners in the area of mental health. What legislators can be comfortable with is that clinicians are trained as clinicians first. They are going to ask questions and be more in tune with certain behaviors, certain side effect ramifications and displays than almost any other kind of practitioner or professional.